time, a lot of time open for questions, and hopefully I can, I can answer whatever you folks are looking for. So before I start, so I'm Ian Wedmore. I'm an emergency physician. I am now the immediate past president of the Wilderness Medical Society. Just turned over the presidency in Spokane to Jen Dow, who's now the president for a year. We used to have a 2-year term, and now we split it up into two: the president and the immediate past president. So I'll be on the executive board for another year, and then I'll roll off. But just for full disclosure, anything I say about the WMS, I am on the executive board. So take that with as much a grain of salt as you feel appropriate, because I can't, I try not to have any conflict of interest, but being on the executive board, I have to let you know I am. I've been involved in wilderness medicine for greater than 30 years, spent just about 30 years in the military, applying a lot of wilderness medicine background and techniques. Ran the Army's Wilderness Medicine Fellowship for a number of years, and I still run the Diploma in Mountain Medicine program for Uniformed Services University and for the DoD. So thanks again, and let me see if I can pull this up here. And who's hosting? Is that Victoria? Is that you or Andrew? Can one of you allow me to share screen?
It's Andrew.
Yeah. Is there?
It would be under settings.
Under settings, let's see. Sorry, I've never had to do
That's
this.
Okay.
Share screen.
I don't know. You know what? Maybe I'll just make you the host, and then you should be able to do it.
Yeah, that should, if you do that, I think that'll work.
Normally it goes to settings, but oh, awesome. Okay, yep, you're the host now.
Okay, there we go. Okay, can you guys see this?
Not yet.
Not right now.
Not right now. Oh, wait a minute.
Yes, we can see this now.
Okay, how's that? Is that good?
Good.
All right. So first, so really what what you guys want to hear about was wilderness medicine as a career. And, first, what is wilderness medicine? I think you guys all know this, but it's medicine in a wilderness setting. So it's austere settings, limited resource, typically far from definitive care. And because I talk about this in the military a lot, what that means is this often involves prolonged field care. So taking care of a patient for much longer than you'd expect. And then, of course, you have to have knowledge of medical conditions that are more unique to wilderness setting: high altitude medicine, dive medicine, lightning injury, heat and cold injury. So for any military folks that are out there, I know you have a few at Texas A&M, this is military medicine. Okay, so the question that often comes up first is, I want wilderness medicine to be my career. How do I do it? Well, the bad news up front is you can't make a career just out of wilderness medicine. But wilderness medicine is a lot of fun, and you can definitely make it a secondary career. So that's really what we'll talk about. All of us that are involved in wilderness medicine, we're still doing our primary careers. I'm an emergency physician. And really what wilderness medicine does is that's the fun part of my career, and it really lets me blend my passion for the wilderness and climbing and skiing, everything else, with my medical profession. So I think that's really what doing a career in wilderness medicine is about, is it's taking your passion for the outdoors, adding it to your medical skills, adding your medical skills to the wilderness, and that really helps you enjoy life and your primary career in medicine. So how do you go about getting into wilderness medicine? You guys are obviously doing a bunch of that already. You've got your wilderness interest club. I like that you're supporting the Livestrong races that I just heard about. So the way that you really get into wilderness medicine as a secondary career is you get experience and you want to get certifications. So wilderness first aid, wilderness first responder, AWLS, which is now wilderness life support medical provider, the diploma in mountain medicine, diploma in dive and marine medicine, and then some sort of fellowship in wilderness medicine. So as you work through those, you gain more experience, and that helps you build your career essentially. Now, what's the, folks usually want to know, well, how should I go about these, in what order? Wilderness first aid or wilderness first responder, if you don't have those, is usually the first entry level. And honestly, those are for non-medical providers. So a lot of you may have skipped right over that. And then you move up to AWLS or the equivalents. Knowles has an equivalent course, Solo has an equivalent course. There's a number of courses out there that are all basically wilderness medicine for medical providers, and they're all good courses. Then the diploma in mountain medicine, that's the internationally recognized standard for having a baseline in mountain medicine across the globe. And after that, the next thing that I usually recommend folks do is go attend a mountaineering course of some sort, like a 5-day glacier mountaineering course, if you didn't do that as part of obtaining your DIM. And then the follow-on bet, that for those that really want some technical skills, is go on and do a rigging for rescue course. If you don't like the mountains and you like the water instead, then it's the diploma in dive and marine medicine. That's the WMS created that, but that's really the new international standard for baseline in diving and marine medicine. And then the ultimate of everything is to obtain a fellowship in wilderness medicine. And that can be done, as you all probably know, a couple of different ways. You can attend a 1 or 2 year long dedicated fellowship that a lot of programs have. I think there's like 16 different wilderness medicine fellowships out there right now across the country. But if you don't have the time or the ability or the desire to have that one dedicated year, then you can obtain it through the Academy of Wilderness Medicine from the Wilderness Medical Society. So what can you do with all this stuff? Well, number one, again, is to have fun. So you're doing this to put yourself in places where you're providing medical support, medical expertise in the things you like to do. So the primary thing that you'll see all of us involved in wilderness medicine doing is being on a search and rescue team, being a volunteer on a ski patrol, being an exposition physician, and then being a medical director for events or any of these organizations. Now, does specialty and level matter? Like, one thing that I often hear is, oh, you can only do wilderness medicine if you're an emergency physician, because most of the fellowships that are out there really only take emergency physicians. And that is not true at all. You can be involved in wilderness medicine regardless of your specialty or your background. We have people at high levels of wilderness medicine from all different specialties. Really, the reason that it's kind of gotten attached more to emergency medicine is that's how emergency medicine fellowships pay for their fellows, is they have to work in the ER to fund their fellowships. And that's why emergency medicine really kind of has the forefront to that. But you look at the Wilderness Medical Society, and we've had a lot of emergency physicians, but we've had orthopedists. We have a woofer that'll be coming up in a couple of years as our president. So it's open to everybody of every different specialty and even every different level. So none of that is going to make a difference. So how do you get involved? Well, you guys are already doing the first thing, which is you have a resident interest group right there. So you're interacting with, having fun with everybody that has a desire for wilderness medicine. So that's your first biggest step. So I always recommend to people, get involved with a student or resident interest group where you are, anything that's local there. If you're not already a member of the WMS, then I recommend joining it. Again, I have some conflict of interest there, but we are the only nonprofit organization dedicated to promoting the research and furthering of instruction in wilderness medicine in the United States, and really recognized as the worldwide leader in wilderness medicine. Volunteer for those things that we talked about. So search and rescue, ski patrol. I know you guys really aren't in an area where you have a lot of opportunities for ski patrol, but I would bet that you have opportunities for mountain bike patrols around those areas. There are a lot of big mountain biking areas in Texas that you could potentially become involved in. Volunteer to go on expeditions. Then after you've taken those courses we talked about for certification, figure out how to teach one. So ask if you can help assist and teach one. Typically these are, you attend a course, you're a motivated, dedicated student, you can ask how to go about teaching them, and the instructors will either hook you up with courses they're running, or a lot of the organizations that run them, you can submit a request to teach a course, and you'll get proctored instructing a course. You'll gain the experience, you'll gain the knowledge, and then if you do that a couple times, then you can actually run your own course. For those that are in the military, there's a number of military courses that are open to you. And I know that that Texas A&M was looking at working on an MOU for your folks to be able to attend the Uniformed Services University's Diploma in Mountain Medicine in Vermont. I'm not sure what the status is on that right now, but I know that that's being worked on. So for one of those military training options, so there's the Marine Corps Mountain Warfare Training School in the Sierras, the Army Mountain War School in Vermont. That's where we teach our school. There's jungle schools around the world. And of course, what USU teaches was what hopefully will be open to you guys under the MOU is the military mountain medicine course, the avalanche and cold weather course, a future dive medicine course, and a future jungle medicine course. So that's the quick entry to wilderness medicine and the background and my recommendations as to how to start getting involved. So I wanted to really leave most of this time open to you folks for questions.
I can kick us off with one if we want. I'm probably the closest one to, I'm still in training, but closest one to be working. There's a lot of med students on here, and then our other faculty advisor is Dr. Fullerton, and she's a PMR doctor who's in her practice. So like I said, I'm applying to sports medicine fellowship. A lot of things I like about sports medicine also kind of correlates with wilderness medicine. So I think I'll be able to find some jobs that overlap with that. But same thing, it seems with a lot of sports medicine, is some of the fun things are more pro bono, but then you can kind of supplement your practice with that. Do you have any suggestions from a sports medicine side?
Yeah, I mean, yeah, certainly it from the sports medicine side. I mean, you're already kind of doing when you talk about supporting those races. So supporting any of those kind of events, so sporting events, wilderness medicine events. I mean, there's always basically suggestions going out for people to help staff the Race the Planet, and there's research being done on those. And typically, even for those, you won't get paid, but they'll fund a lot of your expenses to go out there for it, and they'll provide some stipend. So yeah, sports medicine, you're just right for it, because they're going to want your services at all of those types of events. When we used to have the Eco Primal Quest, the 5-day adventure, expedition length adventure race, that was like the Raid Gula and so forth. They're always looking for people to help cover it. Now the downside is, yeah, you really can't get paid for any of these, and that's why I always say that wilderness medicine is your passion and your secondary career. It's the thing that helps take some of the edge off your primary career, which is what you have to do to make a living, so that you can then support your passion in wilderness medicine.
And then I guess maybe there's some faculty positions at different training places, perhaps, would be.
So certainly if you're in a residency program that wants to have a wilderness program, then you can be the faculty for that. the faculty for the fellowships, and so forth. And even those are primary positions, as a prime faculty, you're still spending, a good majority of your time doing clinical shifts and so forth. But if you really want to get deep into it on the academic side, that's definitely the way to go. I mean, I was a program director for our wilderness fellowship, and loved it because it gave me the opportunity to get out and do wilderness medicine and to teach wilderness medicine. And we provided a lot of training around the United States for folks that were interested in it. Now, half my time was still working shifts in the ER, but I still got to have a good secondary career out of it.
Cool. And how should I go about finding different events or expenditures or things, just kind of whatever interests me and just kind of make connections?
So find whatever interests you, but then, look around your area and see if there is a volunteer search and rescue organization. See if there is, if I can't imagine wherever there's big biking areas that there's not a bike patrol in a lot of those places. So find out who they are, who's doing the volunteer, and then reach out to them and say, hey, can I volunteer? I've got medical training. I mean, all these organizations are always looking for people with medical training to help support what they're doing. And you get great experience. And you get to see really unique cases in a wilderness setting. It's great because it's so different from seeing patients in the clinic and the hospital setting. So I worked as volunteer ski patrol, and we had our fellows do that up at Crystal Mountain. So they'd get a couple days a month where they'd be up skiing and on call, and they'd come down to the clinic and reduce shoulders and evaluate people for head injuries and everything else. So you get into practice medicine and have fun at the same time. Now, the other place is, make connections. The WMS. So if you're not already a member, the Wilderness Medical Society has special interest groups that cover all the different aspects of wilderness medicine. So those you can just join up to and start talking to other people with similar desires in wilderness medicine, similar interests. And that's how you'll find out a lot of the different things that are available. Say, oh, well, I'm from Texas. They'll be, well, I'm from this part of Texas, and this is what we've got going on here, and this is what I volunteer and do. So find out from the folks that are doing it right now. Don't be afraid to email individuals or give them a call, but especially at a conference. That's where you can really meet people from your area and find out what's going on that you had no idea was there.
So I had a question. So, going and volunteering on an expedition seems pretty cool. I think you can go to some pretty cool places, meet a big variety of people doing that. How does one go about finding these expeditions?
So those it's going to be the same thing, but a little bit at a higher level. So in other words, you really need to network with the people that are running the expeditions. But the way that starts is going to be at things like the Wilderness Medical Society, the International Society of Mountain Medicine, those organizations when they have their meetings, because that's when you hear people talk about their expeditions, or you'll meet people like, oh yeah, I'm going to go do this expedition at this point. But those ones you definitely really need to make the connections for. There was a group out of the UK for a while that if you attended their course, they sent the names forward to do Kili expeditions, but haven't seen anything like that in the States right now. That really ends up being all about making connections.
You need other companies giving a background for those kinds of things, or is it really just kind of
I'm sorry, you got a little muffled on that.
I was wondering, do you need any sort of extra background or training for these expeditions typically, or is having a wilderness medical medicine background usually enough?
So it's going to depend on where the expedition is. If you're going to do a small mountain somewhere, wilderness is probably enough. But for any of the big ones, the 8,000 meter Himalayan peaks and so forth, they're going to want experience. But the way you gain experience is you do some small stuff and then you keep working, your way up. The way that I was able to get onto doing some as a medical student was I was climbing in New Hampshire and just got to know a lot of the guides that were there. And when they were going to take a trip overseas, I said, hey, well, do you need a medical provider? I'm a medical student, but I'm also EMT trained, so at least I have some background. And they were like, yeah, we would definitely love to have a medical provider come with us. So that was connection to the lower level, but that's really what you want to do if you want to get onto a big mountain somewhere.
I had a question about the WMS fellowship as opposed to something you can do longitudinally throughout full-time career or something. Have you seen residents successful in completing that, or is this mostly something once you're an attending, you're like a full-time clinician is when you have?
Oh no, I've seen medical students complete it essentially, during medical school. Now, if you're in medical school, you can't complete it. It's not officially complete till you graduate because you have to have your highest level. But I've seen a number of them actually basically have it all completed, and then as soon as they graduate, then they get their FOM at that point. So you can definitely do it as a medical student. You can definitely do it as a resident. To some extent, it's probably easier as a staff after your first year or two because you have more time. But it can easily be done by residents and fellows. It's experiential stuff that most people have the hardest time with, being able to go volunteer and do stuff. But you guys are already doing that. I mean, you'll get credit for your time volunteering for, the Livestrong race. That will count as a wilderness medicine experience. And then if you're involved in running an interest group, that's going to count for some stuff. Some of the easier stuff you can do is you can give talks on wilderness medicine, publish an abstract, publish a poster. Those are the things that still make it very doable for a medical student or a resident. But yeah, I know a number of them that have completed it during medical school and residency, both civilian and military.
Can you talk about the advantage of doing a fellowship in like a formal fellowship like other specialty fellowships? Because I know a lot of these other folks on the call are med students choosing which residency they want to go to, and they may want to go into emergency medicine to then do the fellowship. I think there are some, maybe like 2 that accept family medicine and other specialties, but what would be the advantage of doing that versus the FOM, more of the experiential?
So it, I think the dedicated fellowship is going to give you much more deep dive and deep time into wilderness medicine, right? It's, half of your time is put aside for studying and doing and being involved in and just being in wilderness medicine. So that's the advantage. You're really going to get the best experience in a concentrated period of time with it. And you're right, there's several that have family medicine. We had family medicine for our fellowship. We were going to take an internal medicine individual as well. And again, there's a couple of them have taken PAs into their training programs. And again, the whole issue with that is just how do they fund the fellowship? So typically with family medicine, it's seeing, they have to do so many shifts doing urgent care or clinic time or something to fund it. But any specialty can do it. It's just a lot of the other ones, the fellowships haven't figured out how to get it paid for that way. If you can't take that time, or you don't want to take that time, then that's where the longitudinal one comes in, because you can spread that out over the 5 years and, and concentrate a little bit here, a little bit there. But you're not giving a set aside dedicated time frame like the actual in-person fellowships do.
You feel like not doing any sort of fellowship, let's say, would limit you in like what you're able to do? Obviously, some of those like different diplomas probably open up doors to different types of expeditions or experiences, but does the fellowship hold you back from anything, or is it more for the experience and the skill set that you're learning?
I think obtaining the fellowship either way is really kind of the benefit. Now, the advantage of the dedicated year is it's probably easier for you to make in-depth connections and networking through that, because you have that whole year put aside just for it, and they've got established rotations at different areas and established experiences. Being at work with the National Park Service, so they have something set up to work with search and rescue teams. So they've already sort of preset some of those connections for you. That's the biggest advantage. When you come out of it, I mean, nobody really knows until you tell them if your fellowship was in-house or out-of-house, typically, because the initials you put after your name are probably going to be the FOM, even if it's from a civilian fellowship, because there's not really, established fellowship from a college that goes from that other than the academy. So for a large part, people aren't going to know until you tell them how you got your fellowship. But I think the advantage of that is the connections are sort of more preset and streamlined for you. And let's see. So there's I saw a chat. Let me pull a couple of chats. There are some experiences require primary care or EM, and that is going to be true because it's depending on what the experience is and what and how they've arranged it. There are certainly some that are going to say we want an emergency medicine as a requirement for it, like a lot of the cruise ship medicine, for example, is going to want emergency medicine or maybe family medicine because they want you to be able to take care of that broad range of things there. So that's certainly true, even with the FOM.
Maybe you could share one or two of just kind of your favorite experiences, either just over your career or earlier in your career with wilderness medicine, and some kind of cool things you've gotten to do.
Yeah, so when I was a resident and then junior staff, I mean, I think some of the funnest ones I ever volunteered for were the PromoQuest races. So I did medical support as a volunteer for the Eco PromoQuest, and these were 5 to 10 day long, 300 to 500 mile length expedition races. One was in the San Juans, starting in Telluride. Another one was in Montana in the Big Sky area. Another one was down in Moab. So from those, I really learned everything I ever needed to learn about foot care in the wilderness setting. In Montana, learned firsthand about hypothermia and immersion hypothermia with people swimming in 34-degree water. And the funnest thing is, that whole time I was in the San Juans, or I was in the Big Sky region, or down in Moab in the desert. So that was fantastic. Working volunteer ski patrol, I get to be up on the mountain. I get to ski a little bit. I get to do some fun procedures and take care of some folks and stabilize them before they're either fixed or go to the hospital. I've been an expedition physician on one trip to Nepal where I get to take care of our team and help them through any of the minor issues that came up. Fortunately, nothing big came up during that trip. But it's really all come down to getting to be in a fun place in the outdoors in the wilderness, but also learned a lot from the experience. You can read a lot about this stuff, but until you're actually doing it and practicing it, it really just doesn't settle in. Like they say with all of medicine, right?
Can you say again what the name of that first thing you said, like the 10-day races?
Oh, it was called the PromoQuest race series. It ended a couple of years ago, but it was basically the U.S. equivalent of the Raid Gaulois and a couple of the other big international multi-day. It'd be biking, hiking, canoeing, running, horseback riding, rappelling, climbing, caving, over the course of many, many days. So if they ever start one of those up again, that would definitely be one to volunteer for. But the other, look at Spartan races and a lot of those kind of full day things. You guys doing Livestrong, so you're kind of already doing that. But look at those and see if they're looking for medical support. We both had a team in and did medical support for the Mojave Death Race. That one ended recently, but there's a number of those type of races out there. The Badwater 100, see if reach out to them if you're interested in spending a lot of time in the Heat and Death Valley doing medical support.
Awesome. Thank you.
Does anybody else have any questions, or if not, we can maybe wrap up. And if you have any final comments, Dr. Wedmore, feel free.
I had a question.
Okay.
So how would you say the fellowship translates to like Doctors Without Borders or like relief work in foreign nations?
So it's going to give you, great question. It's going to give you a lot of the background and the kind of minimal experience that you'd want to do that kind of stuff. I mean, there you're really talking about working in austere setting, limited resource, and needing to know how to adapt and take care of individuals without all the stuff you're used to. So it's gonna give you a lot of the experience and training that you'll use actually doing humanitarian missions like that. Mine were all military, but I did a humanitarian mission to Laos. And basically, most what I used was my wilderness medicine experience and training more than anything else. If you apply to Doctors Without Borders, it's things like that that will suggest that you actually do have some baseline experience and ability to work in those particularly challenging austere settings that they're working in routinely.
Anybody else? Okay, if not, Dr. Wedmore, any final comments or anything?
So just the final thing is, I mean, wilderness medicine is fantastic. You get to blend your passion with your primary career and what you're doing, and just start talking to people and making connections. That will be what will get you out there to start doing all these really fun things that will make your life even more enjoyable.
Okay. Well, thank you so much. This was a pleasure to have you, and very interesting to hear and helpful for us going forward.
And if anybody ever has any questions that they want to reach out to me on my email is wedmorei@msn.com. That's my personal email. You can just say something like wilderness medicine or something, and then I won't or at least I'll be able to pick it out of all the other mail that comes along, and I'll have to answer whatever I can for you. And if you have any issues trying to figure stuff out at WMS and so forth, same thing, just go ahead and email me on that.
Well, thank you so much for all that you do for the Wilderness Medicine Society and the field. And then thank you for taking your time to talk with us. We really appreciate it.
Yeah, again, thanks for the invite. And if anybody else is going to be at Banff, I'll be there again this October. So
I'm going on a Utah, the Wilderness Medicine 8-day adventure. In
Canyon
Utah.
Country.
Yeah.
Canyon Country. Oh yeah, that one sounds like a lot of fun.
That's my first time. It's the same week, I think. I would have to double check. It might be after, but I'm very much looking forward to that one.
Yeah. Oh, sounds great.
Yeah. I looked at the Virginia backpacking one too, but chose the Utah one, which is more expensive and longer, but it'll be fun, I think.
Yeah, no, I mean, that's such a cool part of the country.
Yeah.
To be down in that you got to do that.
Yeah.
Especially if you haven't, I mean, you've probably been down there because it's not that far, but
yeah,
if you haven't, it's definitely a place to go.
Yeah, looking forward to it. But thank you so much again for the talk and everything you do for wilderness medicine.
All right, everybody. Thanks.
Okay, bye.
Bye.
Bye-bye.